I'm Courtney Collin with Sanford Health News. I have Emily Griese, Chief Operating and Population Health Officer for Sanford Health Plan, joining me from the Becker's annual meeting. Emily, thanks so much for your time. Good to see you.
Good to see you, Courtney. Thanks for having me.
As you noted at this year's Becker's annual meeting, this is a time of enormous disruption of market forces affecting decision making and outcomes for patients. Emily, what is one thing you are taking away from this conference, especially as it relates to integrated health systems and provider owned health plans?
I think my biggest takeaway, they've got both kind of a payer platform going on right now as well as the provider side. And I think it's very interesting that they've got both going on at the same time. And I think that's a very telling around how we know we have to approach the disruption that's coming at us. The disruption's real. Specialty pharmacy, GLP-1s, the specialty drug costs are significant. The way people want to receive care is significant. We've got to evolve and we've got to change how we approach things. And I think it's really telling that we recognize the need to have both the payer side and the provider side coming together and thinking about these equations together. The way we approach healthcare financing has got to look different than it has in the past. And I think that's where we both bring our strengths, right? Payers understand that ability to manage risk and think a little bit differently about how to use premium dollars, how to make sure we have coverage for our patients and our members. And that's an important voice that we have to have at the table, alongside the obviously important voice of the provider side on how do patients, need to get their care? What does that look like? And what does care coordination look like? So it's just a great time to kind of bring everybody together and think about how we're going to, combat the disruption that we know is coming.
What three adjectives best describe your view of how health systems are working to improve the health of an entire population?
It's a great provocation, Courtney, and I had to think through what adjectives would I use. I think I'll go, I'll certainly use consumer friendly. I think we've got to start thinking about our consumers as patients, members, and honestly as everyday people. I think we've always focused on our patients or our members as individuals, but we see them through that lens and not seeing them as they're a consumer who just wants to live their everyday lives. And how do we approach them differently? And how do we take, again, that integrated way to do that? I think disruptive. I think we have to think differently. We've got to partner in different ways. We've got to get new technology, new digital enablers, new ways to just generally approach our populations. And then I think we've got to be really intentional. And I think we've got to be targeted in how we approach individuals. We can't take a one size fits all approach anymore. People expect different, and honestly, the dollars aren't there to just blanket it across everyone. So how do we make sure everybody's got what they need to live kind of their healthiest lives?
Indeed. Emily, thank you so much for your time.
Thank you, Courtney.